So welcome to week 8. If you all noticed, I did already do the review and I've already posted it. And as I posted it, I put all the Kahoots there that were given either in my class or Professor Brunel's. So you have all the Kahoots that you can have to test yourself on the concepts that will be on this exam. This week, you have a discussion question due. You have a case study, the urinary tract infection, and burns that are due. Also, NCLEX questions. So if you all are having any problems with getting any of this in, let me know before it is late. I need to know by Sunday evening. Listen, this is what's going on. There's a storm. I don't have internet. Whatever the issue is. Because I want to give you that fair chance to get the stuff in. And I know sometimes life shows up. I understand that. Life shows up to me all the time. So this week we're going to do things a little differently, but I think it's going to work well. There are 4 chapters. And if you noticed, it is the GU, so genitourinary, skin, metabolic, and it's also bioterrorism and childhood communicable diseases. Now, I'm going to be teaching the PowerPoints on the urinary system, and I'm also going to do it on the metabolic system because those are very complicated. I have a 56 question Kahoot, I want to say, that will cover everything. So after we do the first 2 chapters on the urinary and metabolic, you're going to get tested on it in the Kahoots, okay? So immediate questions about it. And then the other 2 chapters, the concepts you have to know are in the Kahoots, in the questions. So I'll be talking about that as we do the Kahoots. It's not just going to be me reading the question and you putting an answer. I'll be giving you some information that you need to know about those things. So anybody have any questions? Kimberly, can you come on camera? Aisha, she's having issues with her internet. So Kimberly, can you come on, please? Because if cameras not are on, Dr. Brown is going back and looking at recordings and attendance. Cameras not on.
It's storms in our area also, so Timberly may be having problems also. Mine may come and go also. We're all in Cincinnati.
Phone number? Do you have Timberly's phone number?
I do.
Text her. Just text her. Tell her, please come on camera when she can, please.
Okay. But
I don't want anybody to lose it.
In case mine comes and goes also, we're all in Cincinnati and it's storming really bad.
Oh, I'm sorry. Keep inside. Keep safe. I know what bad storms are. I'm actually originally from very country New York. So I understand the winter storms and the blizzards and the ice and all of that. I was there for the first 24 years of my life. And then I decided I didn't want to have goosebumps on my head with a hat on. So I moved to Miami. And I was actually 24 years old. I moved down. I just wanted to go to the beach and wear the bikini, right? Isn't that what every young girl's dream is? Just becoming a nurse and moving away from mom and dad. And that was hard part, but I've been here ever since. So Miami actually now is my home. So let's go ahead. Let's start out with the genitourinary system and those things that we might see in children. Now, there are a lot of different things that you see with children that you don't see with adults. So it's not just urinary tract and kidney failure. There's a lot of more other stuff there. So one of the things that we look at the genitourinary system and we can actually see if there's any signs that this child has been abused, sexually abused. Sometimes these kids come in that maybe they're bedwetting. They've never bedwetted before and they're starting, or, you're starting seeing like signs and symptoms of urinary tract infection. And many times we have to do a catheterized urine specimen, and we're looking down there very, very closely. And we're going to be seeing, is there, some dripping in the diaper or in the, underwear. I've seen sexual abuse even in small kids less than 1 year old. And what I saw was swelling and redness in the genital areas, and even the vagina looked stretched. So you can actually tell from this. Encopresis is, when you have a little bit of stooling and you're constipated, but there's a little bit of stool water that comes out. Nighttime, those nightmares or night frights are huge. They think somebody's coming after them, maybe that sexual abuser. And of course, any pain in there or irritation, that redness, those are things we see. And maybe all of a sudden this was a really outgoing child and now they're not. They become quiet. All of those things need to be looked at. What could it be? So when we're looking at urinary function, we're looking at the kidneys, the ureters, and the bladder, and are they working the way they should? The most simple thing to check is a urinalysis, or a UA. That UA is going to tell you if there's white blood cells, red blood cells, the protein, glucose. It's a lot of information. And from that, we usually do a urine with a culture, especially if there's any symptoms of irritation or possibility. Now, an ultrasound can start to tell us, what does that bladder, ureters, and kidneys look like? Are they too big, too small? Are there kinks in the ureters? It can even say if there's like any sludge or extra tissue floating around in the urine. Now, IVP, I've mostly seen in children, and mostly older children and young adults that have kidney stones. Kid comes in complaining, and we call this, and one story I have in mind, it was an older gentleman, but he was a cop. He was a sergeant in the police force, came in crying like a baby, and it was kidney stones. And I say that kidney stones is a male's form of labor. I said, this is what a woman feels like in labor. And he's like, yeah, I've never been in labor, but it felt that bad. So that's used for kidney stones. We do CAT scans of kidneys to look at all the structure. Biopsies, maybe there's a persistent sort of infection. Let's see what the tissue looks like. Cystoscopies, looking inside, voiding cystourethropy. This is seeing if the urine, when it comes down, goes out, that it's not refluxing up. And we can tell this by dye that's inserted in the bladder. And we can see, does it go up the ureters? So that sphincter is not holding it down. And if that urine is going up those ureters, it's probably going to hit the kidneys. And it could cause a really bad kidney infection. And then, of course, we can look at the pressure, the urethra, is it holding it fine, and cystograms, all different things depending on what's going on with your child. So what words would we hear when we talk about urinary tract dysfunction? Dysuria or painful urination. Frequency, I have to keep running. Urgency, you can't hold it. Okay, doesn't necessarily mean frequency. It just means, oh, I got to get there or I'm going to wet my pants. Nocturia or enuresis is, going at night. Polyuria is you keep going, and oliguria. Now you don't have any urine. So any of these things can describe something that's going on. Now at birth, you have a male child. One of the decisions is, do I do a circumcision or not? That's always been the question. Well, sometimes you say, well, it's okay, I don't need to do a circumcision. But one of the things you'll be taught with an uncircumcised male from birth is you need to pull down that foreskin, because that skin, there's a space between the penis and the foreskin, and it can collect material called schmegma. And that schmegma is like a petri dish for bacteria. So it gets dirty. So you need to be able to pull that foreskin down. Now, you've all heard about my grandson. I always give you little things about him. Well, he had really bad phimosis, which means even me, and manipulating and trying for a month to pull the foreskin down, I could not. So a decision was made by his mother, because we couldn't pull it down and we were worried about possibilities of urinary tract infections or maybe more as he got older. She decided to do a circumcision on him. You cannot pull it down. I mean, it's so tight, it doesn't come. So phimosis, the concern again then would be infections because of it. Now, sometimes we have something called paraphimosis. Sometimes you get the foreskin down and you can't get it back up. Again, that's just as dangerous. Actually, it's more dangerous than just a tight phimosis or tight foreskin, because you're pinching off blood vessels there. So that child needs to be going into the doctor or to the ER. And you know what we actually do for those children? We put some cool liquid on the foreskin to try to shrink it, to try to be able to pull that foreskin out. I mean, we're not going to put ice down there. We don't want to cause frostbite, but this is one of the treatments that they do and try it that way before they go for surgery or anything. Now, Epispadius or Hypothyroidism, again, is a male. You know, we know that there's a penis and at the end there should be an opening, the urethra. Well, sometimes that urethra is not on the end of the penis, it's on top. And that's called an Epispadius. Sometimes it's not on the top or the end, it's on the bottom, called a Hypospadius. Now, many of these children, parents want to correct it so that they urinate in the way that everybody other male urinates. In this case, this child cannot be circumcised. Well, think about the Jewish faith. What do they do at whatever days after birth? They do a bris. It's part of the celebration, right? Well, they can't cut this child's foreskin off because they're going to need it in order to do a plastic closure. So they want to do it before they're potty trained. So about 18 months, okay? So these children, they splay the penis open, they create a canal, and then they close it up, and then they leave a tube in there, a catheter of some sort. And it just sits there for 7 to 10 days. Nurses do nothing with it. We just keep that tube inside the diaper so you don't get urine everywhere. And these kids, they do really well with these repairs, but it is a big surgery. So there's some pictures of what it could look like. So dorsal is on top, ventral is on the bottom of the penis. Sometimes you're going to hear not an epispadius or hypospadius. They're going to say on the dorsal portion of the penis, it's the up. We know that's epispadius. Now, there are two different times where something in the abdomen is born on the outside. And it's not born inside with the skin closed. One of them is the stomach, can be born on the outside. Everything's connected in the right way, but the skin didn't close. The stomach stayed on the outside. And actually all we do is slowly, we start stuffing it in there, make room in the abdomen. And after about a week, they close it up. We're always concerned about those inside parts getting infected. It's the big thing, and keeping that mucosa moist without getting it infected. But extrophy of the bladder, again, the abdomen didn't close. They call it a midline, lack of a midline closure. And what they do is these kids must stay on their backs, okay? This is the only time that they're there all the time on their back, because we're trying to get the gravity to get that bladder inside. Now, they're still urinating out of the urethra. The bladder is still functioning, still connected to kidneys, but it's on the outside. Again, protect that mucosa, keep it from getting infection. And the leaks of the urine is what we're worried about. That is scoriated skin. So skin barriers and keeping that bladder from getting infected, or keeping that mucosa good. Now, sometimes there's some sort of something that prevents urine from flowing in the right way. calculi, tumor, strictures, scarring, any of these. And those things, many of them can be removed, stents put in, or they can take pieces out and sew them back up. All these things can be done. That's when they're going to be doing all of those X-ray and ultrasounds, etc. Now, hydronephrosis is when the kidney is draining urine, but it's not going down. Usually there's a stricture. So many times, if we catch it soon enough, we can get that kidney working again. Polycystic, there's just cysts in it, so it's not functioning up to where it should. And then sometimes there is a problem where we can't get those kidneys and ureters draining into a bladder, going to urethra and peeing normally. Sometimes that happens. So many of them need what we call a urostomy. You've heard of colostomies, which is the bowel, right? That goes to the abdominal wall. Well, this is urine. So can you imagine being a teenage girl and you're having a bag on your abdomen because that's where the urine's coming out? It can create problems with self-esteem, and that's all about the adolescent self-esteem. So you know what they do? They basically connect it to their bowel. So they'll make the sphincter will be tight, but they're going to be coming through their bowel. So there's no outward appliance for these children. So that is a great choice for these children. Urinary tract infections, most common of all urinary problems. We know it's more common in girls, especially those young ones. They have a very short, wide open urethra, and it's right next to the anus. Remember, we're potty training these kids, and many of them like, get out, mom, lock the door, don't let you in, and they don't wipe front to back, and they could get their stool inside, urethra, which causes urinary tract infection. Most commonly, this is called E. coli. Now, besides that urethra being short, what other things can cause urinary tract infections? Well, those little cute, little tight leggings that they have today are adorable, but your vagina and your peritoneal area can't breathe. So they recommend cotton underwear on these children. They also say increase fluids to keep them drinking and no bubble baths. They shouldn't be sitting in basically dirty water, and they should be offered to go to the bathroom frequently. They should not hold their urine. And a lot of those things, just by, changing the underwear, increasing fluids, no bubble baths, getting them urinating more frequently, kids get starting to play in with a toy and they forget. You can see them wiggling and they have to urinate. It's like, go get to the bathroom. The urine is acidic, okay? But the alkaline urine likes the pathogen, so it helps just a little bit. So what do you see? Signs and symptoms. Well, each kid is different, and it depends on the age of them. So you see the treatment. Infants under 1 usually are hospitalized. And why do you think that? Well, remember their immune systems. Their immune systems aren't built up. They're not where they should be. They could go into overwhelming urosepsis from a urinary tract infection. So they're going to need IV antibiotics to make sure that we get that urinary tract completed. And remember, we're going to do a catheterized urine on this because we want to treat that urine infection one time, not just give them a bagged urine, which is their skin contaminants that we are literally checking. It's, for infection. We want to make sure it's the urine. So that's what we'll do for them. Older kids, they've got more of an immune system. They have that time if they need to go back after they finish the antibiotics, retest their urine, making sure it's gone, and if they need to be placed on another course of antibiotics. So again, making sure that these children need fluid, they need to they need to drink, and they need to make sure they're urinating frequently and not holding it. So prevention, I've basically gone over it, but let's put it here in order. Cleanse the peritoneum, front to back, even the infants, of course, that's us, little babies. No bubble baths. Now, kids can urinate immediately after a bath if they are able to do that. But many of them, they get in the warm water, they pee in the water, right? I mean, you can't help it. It's just what they do with the warmness. They also say with adolescents, if they're sexually active and are having urinary tract infections, if they urinate immediately after sex, it can help prevent urinary tract infections. So it's the same sort of concept. The bath, sex, it's something dirty contaminant there. Let's flush it out of the bladder. Using white, that means no colors in the cotton underwear, loose fitting pants, and again, enough fluid intake. Now, nephrotic syndrome, I'm going to say this twice, has nothing to do with renal failure. Nephrotic syndrome is not renal failure. What is it? The kidneys say, protein, I don't like you, and it starts to urinate out all the protein in your body. Okay, so what are you going to see with these children? Well, you're losing all the protein in your blood. So you have hypoalbuminemia, which means you got to be careful now with giving medications because you need smaller doses. You also, because you have less solvent or things in the vasculature in the blood system, what the blood goes, it says, let me get all the liquid, go out interstitially and try to find the solvent, because they like an isotonic solution. I mean, the whole body likes that. So it goes into interstitial and they all swell up. Mostly these kids, you see their eyes all puffy and you'll see their mouth, gums, and their tongue. This is one of the most evident things you see there when you see a kid with nephrotic syndrome who's holding urine. It's boys ages 2 to 7. Sometimes it has something to do with T cell dysfunction, but prognosis is good. I mean, these children do take steroids to get over it. And because of all this fluid retention, these children will need a low sodium and decreased fluids into their body. So what would you see if you had a kid with nephrotic syndrome come, into the doctor's office? Well, again, you'll see that swelling like I told you, but you're going to look at the weight. I mean, it's one of the reasons why we do height and weight at every single visit, whether doctor's office or whether in the ER, urgent care, doesn't matter. We want to see their weight. It tells us a lot. Well, weight gain tells us they're gaining fluid. So that could be a hint of it. They might be pale, irritable, listless. They don't feel too good because of this lack of protein. And the poor appetite is your mouths are all swollen, interstitial tissue swollen. They probably bit on their gums. It hurts to chew, to swallow, so they don't eat. Because kids, when something hurts, they don't do it. Their blood pressure is usually normal, though. It's not like a glomerulonephritis or like a nephrotic failure. No, nephrotic syndrome, you're going to basically have a normal blood pressure. Again, that urine is going to foam like a beer, and it's going to be because of all the albumin or protein. Remember, albumin and protein are the same thing. It's a different word, but it means the same thing. And these children, because their counts go really low, they become very neutropenic. You're neutropenic, you don't have white cells, you can't fight infections, so you're prone to infections. So as I said, they're going to get steroids to reduce the proteinuria and the edema. But one of the things about steroids can mask signs of infection. So you've got to be very careful and look for it closely. Again, as I said, you're losing protein. You've got to give smaller doses of medication so that can have toxicity really, really quickly. Now, diuretics don't really work with nephrotic syndrome. You think they're swollen, they have edema, I mean, peripheral edema, you give some furosemide, some Lasix, it works, right? Not with this. Again, avoid the salts, and of course, fluid should be decreased when they're really swollen, but at other times they can drink fluids as they want. So what are we going to do with these children? Well, again, we're going to be teaching them they should be watching their weight. Any drastic weight gain could mean that they're starting to have, a flare-up of the nephrotic syndrome, need to get to the doctor, get some steroids, right? Again, this child is immunosuppressed. Remember, they have neutropenia. They don't fight infection. So no live vaccines. Again, with prednisone, steroids, again, you're immunosuppressed, no live vaccines. I mean, the family can take it, but these children cannot take it. Remember, they need to be turned, they need position, move that fluid around so it can move through the body so they can urinate it, and always watching their fluid balance. How do you watch fluid balance? Intake, output, and strict daily weights, okay? And then as nurses, making sure that we are good about hand washing and using gloves and masks, et cetera, et cetera. Now, in the cardiac area, we're talking about strep throats, and it causes rheumatic fever. But if we treat the strep throat, everything will return to normal except if there is heart valve damage. Well, when we're talking glomerulonephritis, again, it's caused by a strep throat that wasn't treated completely or not at all. Again, it could be one kidney, both kidneys. You're going to see these children hypertensive. You're going to see these children oliguric. They're going to be stopping urinating, or a little bit red or very concentrated urine. Treat them and they turn around, and most of the time, 99%, it'll be just an acute stage. It won't be chronic. Now, Wilms tumor, nephroblastoma, which means a tumor on the kidney. It's usually about boys ages 3 to 7, African American, and I've seen one in my career. Was a little boy who came over after that Haitian earthquake back in 2010, I believe, and our hospital went to it. And apparently they found this child. Somehow they got this religious group to get the child over, and they picked him up at the airport with whatever medical records, and they were told to bring him immediately to the ER, where there I am, the triage nurse. So I said, so what is wrong with this child? And they went, I don't know. They told us to pick him up, bring him here, here's the records. Well, the records were in French. So now what do? Where do I place this child? How sick is he? I don't know. Well, I did an assessment. Number one, I looked at him and he was just a quiet boy, didn't seem to be in any acute distress. I did vital signs, listened to his lungs. Then I started listening to his abdomen. And when I got down to the left lower quadrant, I felt a softball-sized mass. And to this day, I don't know why I knew it was a Wilms tumor. The big thing about Wilms tumor is that these masses are fragile, which means pieces can break off, go into the peritoneal cavity, and could cause, a metastasis of the tumor. So these, we never are over manipulating the abdomen. We must be careful during diaper changes. A lot of 3-year-olds still are with diapers, or whenever we're manipulating that abdomen. They don't do biopsies or anything before surgery. So they go in and they take it out, okay? Again, we're talking about a kidney. So it may cause the blood pressure to be elevated. I mean, when you think of kidney failure, yeah, your blood pressure is up, and you always think about potassium, because potassium's always involved, and also red blood cells or your hemoglobin hematocrit. All those things are all in the kidney when you think anything with any questions involving a kidney. So again, These children on the charts, on the bed, I would like to even put one on their forehead. Do not touch the abdomen, no palpation, because it can be a life or death situation with these children. They'll do surgery, sometimes after radiation or chemo, they'll do one, the other, the both, and then the surgery is done. Remember that these children are going to have a big abdominal scar. And again, preoperatively, leave that abdomen alone. And then postoperatively, you've touched a kidney, make sure you look at intake, output. And those kidneys are at the back of the abdomen. They've manipulated their intestines. So making sure that they're stooling, very important. Now, hydrocele, hydro is water, fluid. Basically, it's fluid in the testicle sac. And usually what you see with this is swelling of the testicle and maybe a little pain. And I've also heard that sometimes they're incontinent when they're potty trained. Usually you go in, give antibiotics, they do well. If it doesn't, then they're going to do surgery. Cryptorchidism, again, another male. This is when the testicles don't come into the sac. Of those of you who've had baby boys, one of the first things, besides after they do the hip check, make sure their hips are fine, they check the testicles, right? What they're doing with filling that sac is to see, are the testicles in there? Now, one of the things that we need to do to perform an accurate testicle exam is keep it warm in that examination room. Males who, when it's cold, their testicles suck up in close to them. When it's warm, they tend to hang. And we want that hanging to be able to feel those testicles to make sure that it's there, okay? They do surgical repair and they can get it down. So that is cryptorchidism. Now, sometimes these children are going to need some sort of hormonal management in order to get it down, to get it where it needs to go. Sometimes it can, if we don't get it down quick enough, basically those testicles have been baked inside the abdomen and it has stopped the ability to produce sperm, which, you know, makes them infertile. Could be one side, could be both sides. And then with these children, you always worry about testicular cancers. So how do we take care of cryptorchidism? Well, we want to make sure that those testicles are supported. If they're young kids, you know, making sure their underwear is holded up there, right? Or they're using a support. Sometimes there's this nice suture line there, make sure it's intact. And as these kids getting older, making sure they're doing testicular self-exams, checking to see if there's any extra lumps or bumps are in there. And, you know, they're talking about their private part. It's very embarrassing for children, right? They don't want to show themselves. They're very embarrassed. And they're afraid, you know, of being mutilated. They're afraid that their testicles are going to be cut off. So again, make them know that, you know, it still works. The penis is still there. The testicles are still there. We're just making sure that they're where they should be, because this is really a scary thing for kids of all ages. So there we go. Another thing, impact of urinary or genital surgery on growth and development. So we know that young kids do start touching themselves. You know, they start playing with themselves. They're masturbating, girls and boys. They're starting to say, oh, what's this? And they start doing that. You know, a lot of kids do it, you know, in front of people. And I know my grandson loves to touch his thing. I'm like, could you go in the bathroom into your own room? I don't need to be watching you touching yourself. Make it like it's no big deal, but I don't need to see it. You know, it's just part of that curiosity that they do need. And remember, getting them to understand why they're having these surgeries and what's going to happen, and being honest, very important with these children. So that is a GU. So a lot of little different things you didn't think about, wasn't there? You don't think of, you know, cryptorchidism, or you don't think of, you know, hydroceles, etc. Any questions yet? Okay, let's go to metabolic. When you think of metabolic, what do you think about? There's two big ones. You're going to think of endocrine, and you're going to think of pituitary and thyroid and diabetes. Those are basically endocrine, metabolic. So the endocrine system, this is a great picture. It's in your book. But these are all the things that produce hormones that affects your sexuality. It helps with your sugar digestion, has to do, the parathyroid's about calcium and bones and growth. And pituitary glands has to do, again, with fluid balances and growth also. And of course, the thyroid too, it has to do with growth and cognitive awareness. So hormones, what are they? It's something that wherever you're talking about, the thyroid, pituitary gland, even the testicles, what do? They produce some sort of substance that performs a task. You know, the pituitary, a lot of it has to do with growth. Are you growing too slow, too fast? Because it could be too much or too little. And there's treatment for either side of that. You don't want too little, you know, because you need just enough. And too much can cause some really severe side effects. So the absence or deficiency can, in some sort of enzymes, can really play a part of these metabolic problems. Now, one of the things about metabolism, a lot of these things can be seen, you know, when the baby's intrautero. You can find them out, but sometimes they can't see everything. But if we start seeing things like, you know, they're born and they're just really lethargic, they don't eat well, you know, sucking, swallowing, breathing, they don't want. All of these things, we can say something's wrong. I mean, one of the big things is having a stool right after birth. If they don't, they're going to be looking for thyroid problems. It could be one of the things that it could cause. It may not be thyroid, something else, but they'll be looking because that's, you need thyroid for cognitive awareness and for growth. As I said, for instance, thyroid, I think it's one of the biggest ones. You know, if you do not have enough of these hormones, remember, all of these things feed your body to grow. And children are growing until they become adults. If they don't have all the hormones they need, they're not going to be at the best they can be. And a lot of it has to do with cognitive or mental development. Also has to do with, you know, this, you know, are you tall? Are you short? Are you fat? Are you skinny? All of those things can be involved and be a cause of metabolic dysfunction. So at birth, you know, we can do x-rays and look. One of the symptoms of not having stools at birth is something in the intestines. Well, an x-ray can show that. That PKU test, those little circles that we do right after birth, those 5 little circles, again, looking for metabolic problems. Chromosomal. Is the body have the proper chromosomes? Are there something that we need to look at due to a deletion or addition of a chromosome, part of or all? We can do tissue biopsies. We can look at the thyroid gland. We can look at the testicles. We can, you know, sometimes it's the, you know, pituitary. Sometimes we need to go take a little piece and look at it. Again, thyroid function. I mean, what do we look at thyroid dysfunction? T3, T4, TSH. It's just these lab values. It's a simple blood test. And then we could do an ultrasound. Is the thyroid the size that we want? And one of the big things they do with hormones and checking them and metabolic is 24-hour urines. Do they have the things that we want in it? Is it too little or is it too much? Also, one of the things that we can have is something called Tay-Sachs disease. It is in a lot in the Jewish population, the Ashkenazi Jewish population. I guess it's a section where they were born. Usually that's what it denotes. And what happens is they have a deficiency in this enzyme that metabolizes fats. So you have these fats floating around in the body, and what happens is it just jumps on these nerve cells and smothers them, and then it's not going to be able to move physically, or it's in the brain. You're not going to have memory or speech or any of these things. It just stops it from having it. And it is a recessive trait, but Tay-Sachs disease, we can look at those mother and father if they have it. So in Tay-Sachs, these kids are born normal because how much fat have they had already, right? Then we start giving them breast milk and we start giving them their formulas and feeding them their milk. And then all of a sudden they start to see those cognitive delays. I mean, why do we need to know when their head picks up and when they should turn over? And if they're not rolling over, what do we need to look for? Well, this is one of the things that we would look for. That's why we know when it's going to be a voluntary palmar grasp or a pincer grasp or building blocks or walking unaided steps, unassisted steps by 1 year. They're not doing what they're supposed to do. They'll be looking for it. Now, there is nothing we can do for Tay-Sachs. All we do is treat what we see, and they call that palliative. It's nothing that can cure it. Now, I've mentioned several times already hypothyroidism. And as I said, the thyroid gland secretes thyroid hormone, and that thyroid hormone is important for the metabolism of the body, and it's also helps with cognitive awareness. And children born with low thyroid, you're going to see those things in those fine motor and gross motor with delays. You will see them. Cute little thing. Now, manifestations, what would you see? Well, hypothyroidism in adults, you're going to be lethargy, cold intolerance, extra hair, skin is going to be dry. But in the children world, you're also going to see growth delays. So this child is going to be sluggish and sleeps a lot. Their tongue, it gets big, and they start making this little noisy respirations. As I said, their skin is dry, okay? You're going to see their feet and their hands are going to be cold, and they're not going to have good muscle control, so they'll be floppy. I mean, even in hypothyroidism in the adults, constipation is one of those top of the list things. So same thing, the hair, dry and brittle. And as I said, when you're talking about infants and you're talking about hypothyroidism, the biggest concern of all is cognitive delays. And if we don't treat that, they're going to have irreversible mental retardation and physical disabilities because we didn't treat this as soon as we could have. Now, juvenile hypothyroidism is something that we call actually Hashimoto's. It's an autoimmune type of thyroidism. And this is something, it's older kids, usually girls. All the symptoms are really similar. My daughter-in-law actually has this Hashimoto or lymphocytic thyroiditis. They're immunosuppressed, these children. This is something that you wouldn't remove. You cannot remove the thyroid in this. What you have to do is follow their thyroid levels closely and make sure they're on the supplements that they do need. Because again, it's going to cause mental decline or retardation and neurological complications. I know my daughter-in-law tells me her moods are up and down if her thyroid hormones aren't where they should be. So a screening test is mandatory in the United States for hypothyroidism because, you know, this is all cognitive awareness. This is having a child who's alert oriented and has the best start they can. So how do we treat it? Well, we're going to give a synthetic hormone. We're going to be giving, that levothyroxine and something that we give. Of course, the kids are growing quick. And we have to adjust that according to when they get older, and we need to monitor their hormone levels when we can. It should be given in the morning, same time every day, because it literally gives them a boost. Because remember, without, they're lethargic, okay? Now, children with hypothyroidism, again, it's that hair and it's sleeplessness, aggressiveness can happen. Once they get that hormone level where it needs to be, these kids do really, really well. And it's something that they'll have to take for life. There's no cure. It's just your thyroid's not producing enough hormone, so you need to take those replacements. Now, that's too little thyroid. Well, what about too much? Well, too much is everything is on speed, let's say. You rapid heart rate, blood pressure up, chest pain, you're losing weight, you can't sleep, you're constipated. It's like all of these things are going on. That's with too much. Now, too little is when you just can't get out of bed and you're tired. So these are things we need to teach our parents. So let's say maybe the kid took this medication and forgot and took it again. I mean, it can happen. If you're ever on medications every day, do you remember it every day? Have you ever taken an extra dose? Well, it could happen, especially if this kid now is to the point where they're taking their own medications when they should. And a double dose could cause, and it's, it's called a thyroid storm type thing, where the heart rate goes on and you get hard to breathe and it's chest pain and you get irritable. And if it continues, you'll see that weight loss going on. Now, diabetes insipidus. Okay, I want to say something twice again. Has nothing to do with blood sugar. Diabetes insipidus has nothing to do with blood sugars. Diabetes insipidus is a hormone problem with the pituitary gland, and too much hormone is either given or it's withheld. And diabetes insipidus, you see two things. You urinate a lot and you're thirsty a lot. How do we treat diabetes insipidus? Well, we give something called vasopressin, which is an anti-diuretic hormone. So anti-urinating, anti-diuretic, we stop that urinating, okay? So, and well, of course, with this in the hospital, what are we going to do? We're going to be monitoring the heart rate and the blood pressure. And of course, we're going to watch daily weights and take an output. So there are two hormones that you're going to be seeing in the pituitary gland. And one of them you're going to see has to do with growth. Too much growth, too tall, gigantism, or too short, which would be dwarfism. Again, if you don't have enough, we give some. You have too much, that is usually they have to go and take that pituitary lobe out because it's overreactive and then give replacements. Now, the other side of the gland, the posterior, has to do like diabetes insipidus, all about urine, holding it or not holding it. So diabetes insipidus is thirsty and urinating. The what we call the SIADH, or syndrome of anti-diuretic hormone. So syndrome of anti-diuretic means this child's not urinating. So either you're urinating or you're not urinating. If you're not urinating, that means you're filling up with fluids. So those are the difference in those metabolic with those two things. Now, thyroid gland has to do with growth and cognition, right? Well, there's something right next to the thyroid gland called a parathyroid. A parathyroid gland has all about calcium regulation. Calcium always works with muscles and bones and tendons, okay? If you don't have enough calcium, you don't have muscle strength. So how do we treat it? You give replacements. If you have too much, you are to the point where you're in spasms because, or tetany it's called, because it's too much thyroid. Again, we're going to do something to get that calcium down. Now, adrenal gland has to do with steroids or sex steroids. So the adrenal gland, we've heard of Addison's disease and there's Cushing's disease. Now, Addison's is usually a disease that we see at birth where the sex of the child, we don't know what it is because the adrenal gland didn't give enough sex steroids. So these children are going to be needing cortisol and aldosterone because that's what it regulates. They're going to be on it for life. Now, Cushing's disease is too much of this cortisol. Usually that too much of cortisol is a tumor, but we also see that when we're given too many steroids for too long. I was placed on, in the very beginning of my thing with this rheumatoid arthritis, a pretty large dose of steroids every single day. And over a year, year and a half, I gained 80 pounds and I looked like the Pillsbury dough girl, all in the abdomen, all swollen, big moon face. It was just part of what that is. Okay, diabetes mellitus. This is the blood sugar. This is all about the pancreas secreting insulin to be able to, the insulin goes in and makes carbohydrates in a way that the body can use it. Now, what happens in diabetes mellitus? Now, there's 1 and there's 2. Most children are 1, diabetes type 1. That means they need insulin injections in order for them to digest carbohydrates. Now, what happens if they don't get this insulin? And it's usually right when we see these children and we're trying to diagnose them. Well, the body has no insulin. You're eating sugars, carbohydrates, but you can't use them. So you're going to smell that sugar in the breath. You're going to see that sugar in the urine. Well, the body's still hungry. So what does it do? It needs to eat. It can't use sugar. Your blood sugars are probably over 500. The highest one I've ever seen, I believe, was 1108. 1,108. It was like amazing. I had never, one kid I've ever seen, and the kid made it, that was the most amazing part. His pH in his ABG was 6.9 something. I mean, he was a sick little kid, but he came through it. Anyway, so I have sugar. It's in the body. I can smell it. I can see it in the urine, but my body's not using it. So my body's hungry. So it goes to the fat and it goes to protein, and that digestion causes ketones. That's why you're going to see ketones in the urine. 4+ sugar, 4+ ketones, and that's what you see. So if you're not getting enough sugar in the body, your body's not getting the energy and the nutrients it needs. So this child is going to be a smaller child. So we need to watch out for that. That smell of sugar is usually the first thing you smell. It smells actually like rotten peaches. Take a peach, put it in a Tupperware dish, put it in the refrigerator for a month. Take it out and open the top, and that rotten sweet smells like what diabetes DKA smells like. It's the way I can describe it to you. Now, I've worked a lot with children who come in, a couple times a year in diabetic ketoacidosis for whatever reason, okay? A lot of it has to do with their non-compliance of taking insulin, watching their blood sugars, doing their checks of their sugar daily. They're not doing it. And they're, teenagers. Now, what I have done is sit down with these children and tell them the long-term complications if they don't take care of themselves. Well, the one thing girls like are their eyes, right? They like to put makeup on. They like, the new way of putting the liners and the colors and, having lashes. I mean, that's something girls like. So I tell them, do you realize if you keep doing what you're doing, you're going to go blind and you're not going to be able to see out of those eyes? And I said, you have beautiful eyes. And they go, oh, and sometimes that's what they need to hear. They also get these, what we call neuropathies. I mean, I've heard of peripheral neuropathy and the feet get numb, etc. But what do I tell the boys? Now, I had a nursing tech. It was a boy, good looking kid. He was 21 years old, type 1 diabetic. He comes in and he's eating this huge piece of cake from some party that was at work. And I'm like, what are you doing? And he goes, oh, I was hungry. I'll just up the insulin. And I said, Danny, that's okay. I said, but do you realize what the long-term consequence of you taking your sugar up and down like that is? And he goes, yeah, I know. It's, I'm like, no. Do you realize that your male organ will stop working? And he goes, what? You're teasing me. I'm like, no, remember, neuropathy, nerves don't work. The sugar's, always highs and low. And, I turned that child's life around. And he actually, a couple of years later, thanked me because he started not doing what he was doing. Oh, I'll just crank up the insulin, give me more. We know it causes kidney disease. We know it causes problems with circulation with that neuropathy. Many people who become older, don't take care of themselves, end up with, amputations of their legs, below the knee, above the knee, of the knee. There's all types of diabetes. As I said, number one, you need insulin. Number two are usually the older children, the teenagers. Usually they're a little bit overweight, and that's what caused the type 2. That can be turned around. Type 1, you're diabetic for life. Gestational, you're pregnant and your blood sugars are out of control. Many of those, parents, those mothers who are gestational can become diabetic later on in life. So it's something to be watching for. And look at the chromosome defects, the important numbers. 6, 7, 12, and 20 all are associated with diabetes. So if we have those hormones going on, we know diabetes. So what's the criteria? Well, blood sugars, is it 100? What's the number? In children, it's a little different than it is adults. We give them a little bit more. In adults, it's 100. But a fasting blood sugar for a child, and it's 8 hours of time, is 126, their blood sugar. There are type 1, as I said, that's the autoimmune, the insulin don't work. And then type 2, something happened and it stops. It causes resistance to the insulin, and again, there's medications, oral medications that we can do for that. So in children, diabetes mellitus, actually the youngest one I can remember to this day was this 3-year-old blonde hair, blue-eyed, beautiful little girl. Came in to the ER because she had come from the doctor's office and the blood sugar was too high to register on the machine. She was eating a lot, she was thirsty a lot, and urinating a lot. So this is 3 Ps. Diabetes insipidus is only 2 Ps. It has nothing to do with sugar. The third one, which is this one, is polyphagia, polyuria, polydipsia. So thirsty, urinating, hungry. That's what you see in diabetes insipidus. So these children between 5 to 7, you're going to see it happen because of stress. And, stress affects your whole body. And then 11 to 13, this is that pre-adolescent growth spurt. This is when you're starting to go into puberty and menstruation and all that, and all those hormones that can cause it too. So Children are extremely hard to manage. These children have to watch their blood sugars before going out on the field and playing. They need to have snacks just in case they go to hypoglycemia. It needs very, very close monitoring and keeping them hydrated during. I mean, they can play soccer and whatever. It doesn't matter. It's just they just have to be prepared for those things. So as I said, diabetes mellitus type 1. I'm hungry, I'm thirsty, and I'm urinating a lot. And it happens pretty quick, all right? And then all of a sudden, you're going to see them get tired and weak. Many of these children who come in DKA they look pale. Their heads are hanging over, and they're coming in a wheelchair. And you can smell the sugar coming off of them. So you start an IV, get the fluid in them, start a regular insulin, slow, continuous drip. I'm telling you, an hour later, they're pink, alert, and oriented and look like a new kid. It's amazing the difference of them. You might also see some vaginal yeast infections in them. Now, again, hyperglycemia going into diabetic ketoacidosis means the sugar's not being eaten. So the body's hungry. So it goes to protein and fat, and the byproduct is ketones. So the blood sugars are elevated, and ketones are 4+ large in the urine. It's what we see with them. So this honeymoon period of type 1. So after the initial diagnosis, you are going to give them insulin and everything looks really good. But the insulin requirements do go down as you're feeling well. You're not as stressed, because remember, stress causes a need for more, and we know that parents don't want to believe their kid has this disease. So maybe they're not watching it as closely as they should. But these children are doing well initially, but they need to be watched closely because this honeymoon period goes away pretty quick. So what do we do for diabetes? And what tests do we need to take to sort of prove it? Well, you can do random blood sugars at any time. But fasting blood sugars, as I said, 126, you're going to say on 2 different occasions. Because sometimes they'll say, oh, I had cake last night before I went to bed. This can't be accurate. Well, then just do it, eat your dinner normally and, take it again. Another thing they can do is a glucose tolerance test. Now, there are pregnant women who have diabetes of pregnancy. They all do this glucose tolerance test, and they all go, "Oh, it's so bad, I wanted to vomit, but I didn't want to vomit because I'd have to do it again." But it's that glucose is 200 milligrams per deciliter. It's just part of that test. Now, the one that really can show us this is diabetes mellitus is what we call a glycosated hemoglobin, or HbA1c. And what that shows us is 3 to 4 months of blood sugars. Where are they? And if we see them elevated, we can say, yes, this is diabetes. So we also, after they're diagnosed, we can see if they're controlling their blood sugar well or not. Mentioned it several times, diabetic ketoacidosis. This is what we call that diabetic coma. As I said, they come in pale, leaning over, lethargic. Why do they go into this diabetic ketoacidosis? Well, usually it's from undue stress, but it could be due to them being sick, the secondary infection, or they're just not following their blood sugars and giving, insulin as they need there. And we know if you're not getting enough insulin to a patient who's diabetic, they're not using sugar, so they're going to start eating other body foods, which is fats and the proteins. And then, of course, you get ketoacidosis, ketonuria, and they're going to be dehydrated. Again, that rotten fruit smell, that peach, nausea, that altered sense level of consciousness, And it can be in hours, this can happen. Sometimes it's over a couple days, depending, but usually it's pretty quick, these things happen. So we really want to monitor those diabetes. We want a kid to be a normal kid, but they need to know how to take blood sugars before they go out and play a ball game or do something, that's strenuous, making sure that they're kept hydrated, make sure they have snacks, making sure they're taking their insulin, making sure that they're following up with the doctors, et cetera, because, your body needs sugar to grow, but it needs to be able to be metabolized. So we know a lot of insulin is very expensive. Those pens they have out today, they could be $300-400 a pen after insurance. So there are a lot of companies today that you can get them cheaper. Again, that's the medical personnel looking out for their patients and making sure that we do try to get those free or reduced charges. Also, the one thing you don't think about, the Jewish religion doesn't want pork. There's also some religions in Jamaica where they don't want pork. They are more vegetarian. The Indians from India, they don't want vegetables or pork. Now, there is pork-based insulin. That this is something against all the religious beliefs. So making sure that they're getting what they need and that they will use, because they're not going to use it once they see it's pork. So remember, with diabetes, you're going to have these blood sugars that are up and down. So growth is not going to be, steady. It's that spurts and those plateaus that goes on there. We know that sometimes there's problems with keeping them hydrated. Kids have what we call irregular activity and eating patterns. Some days they eat a lot, sometimes they don't eat at all. Sometimes they're active, sometimes they're not, or sometimes all the time. So all of these things play a part in trying to keep a blood sugar the way that they should. And then having a kid take care of themselves, having the responsibility of making sure they check their blood sugars when they wake up. Kids 4 and 5 years old should be able to do that, but it takes a lot of patience by parents. And then think about when they go through puberty and all those hormone changes and then those growth spurts that go on. All of these things are going to need different diet, different insulin requirements, et cetera. So again, teaching those adolescents how to take care of themselves, to be on that well-balanced diet, to get that insulin they need, and then to be active, but to keep themselves safe as they're being active. So again, teaching the plan. You can see diabetes has a lot to do with it. We know it's about the pancreas, that the islets of Langerhans, are not producing the insulin. It's an autoimmune disease. The body's, attacking itself, that we need to watch. The blood sugars, we need to be careful on diet, giving insulin when they need, and when they're exercising, making sure that their body's ready for exercise. You're not going to go into exercise if your blood sugar is 76 without eating something first. You want your blood sugar to be above that 126 so that you have that expenditure of sugar you need for that energy. Again, with those neuropathies, taking care of infections, foot and skin problems, knowing that stress, emotions do affect blood sugars, checking urine, checking those glucoses. And when you're traveling, making sure you have your insulins with you, that you have those snacks that you need, making sure that you follow up with doctors. And illnesses or surgery both do affect your body, so to be monitoring the glucose as well as we can. It is for normal growth and development, nutrition. No nutrition, you're not going to grow the way that you should. So we need to eat a diet that's according to their age and their weight and according to what their family can afford, right? Sometimes you can't afford all of what we want, fruits and vegetables, because we know they're more expensive. There's other choices, but maybe there's something we can do in the community. There's a lot of these food banks out there today. Maybe it's something that we could introduce them to. We know fiber, the increase of fiber can reduce glucose blood glucoses and serum cholesterol. And your glucoses are down, your insulin is going to go down. So fiber would be something that we tell them about. Remember, as we're looking at food labels, be very careful. They like to use these words that don't really mean what we as consumers would think. So make sure that if it says, it's dietetic, what does that mean? I mean, does it mean it's half the sugar? I mean, half the sugar still may be too much. So teaching a child and a parent to give insulin using one needle and throwing it out, don't use it, putting it in a proper place. And insulin is only through a sub-Q injection. It's not anything that's given orally. We can give it depending on the skin. If you're very skinny, it might be 45 degrees. But if you have a little bit of meat on you, it could be 90 degrees. And of course, changing where they give it, changing the site. They say at 7 years of age, we can teach a child. Now, some kids that are smaller could too, but they're saying 7. Again, if this child has an area where maybe it's had a sore or something on it, a dermatitis, that's nowhere where we would put an injection. Has to be in good, healthy skin, okay? We can cause this crunkly skin. It's called the lipoatrophy, which means it just gets crunchy and you can't get a needle into it. It's almost like a crunch if you do the same place every day, all the time. So again, make sure that when we inject, if they move their legs, that absorbs it. You don't need to rub it into the skin. And these are all the places where we can put it. How to mix clear before cloudy, right? And today, we're actually lucky. We've got a lot of pens that do this stuff for us. It wasn't there before. Remember that the length and time that it works is something that we need to remember. We're giving regular insulin. Make sure that this child gets something to eat if it's before breakfast or lunch, that we don't just let them sit there because they can go hypoglycemic. And what is great today, they do have an insulin pump and many children do use it. And it's one needle, they stick it in with a tubing on this little pump, and these kids can bolus in their own sort of extra doses, etc. It's great. And then insulin shock. Low blood sugar, hypoglycemia. What could it be from? Well, you didn't check your blood sugar before you went to exercise, or you took your insulin, you didn't eat. So all of these things can cause too much insulin and can cause you to get, dizzy and sweating and nauseous, all of those things. So the insulin reaction, you'll see is irritable. They're not acting right. They're sweating. They're jittery. They're hungry. They're weak. All of these things are signs and symptoms. So they need to have something right away. So sometimes I've been in a restaurant where they took a pack of sugar and put it down quick because they needed something quick. Orange juice, hard candies. They've got things that are made, but you have to buy them. Why? You just get some lifesavers, right? That works well. Even a glass of milk is good. And you feel better pretty quick. But if this adult is comatose, you're not putting anything in the mouth, they'll choke it. That's when they would get an injection of glucagon, which gives them massive sugar right away. Somogy is something that happens is, you have a low blood sugar, you give sugar, and all of a sudden your blood sugar goes really high. It's what is called the Somogy phenomenon. So it just causes a rapid raise in blood glucoses. So Somogy also, it's usually that person who's been on insulin for a while. And what you see is during the night, they're sleeping. They don't really feel it. They go into hypoglycemia. And then they wake up in the morning and their blood sugars are elevated. So this is, again, called Somogy. Now, how do we take care of this high-low? Decreasing the insulin and watching the diet. So diabetes, this emoji is sometimes due to this obesity. That means you're not up and moving, and sometimes too much fat in the diet can cause this. So again, watching their diet, their insulin, their medications, and their hydration. So you can see there's a lot on diabetes there, isn't there? Did you understand diabetes and what happens with it? Can't use sugar. What do you use? What's left? Fats, proteins. And what does that cause? Ketones to be formed. So remember, diabetes insipidus is only 2 Ps. You're not hungry. It has nothing to do with blood sugars, right? It's only thirsty and urinate. And then diabetes mellitus is I'm hungry because there's no sugar. The sugar's not being used. So hungry, thirsty, and urinate. So let's go ahead and do our Kahoots. So I said there's 56 of them, trying to give you a test of what you just took. And it's going to be the other 2 chapters, those concepts that you need to know for your exam and for your HESI, okay? Any questions yet? All right, let's get going. And then when we're done, we're going to be doing the quiz. So chapters 29 through 32. A newborn scrotum is enlarged and swollen on one side. Why? This we did cover. So you have an immediate quiz on that stuff that I did cover, and then you have the information that's required for you for the other 2 chapters. So collection of fluid that most likely will correct itself in a year. Most of the time they are. Sometimes if a child is older and has that swelling, it could be a hydrocele, right? And that one probably will require an antibiotic, and that usually corrects it. Providing information to parents of a child born with bilateral cryptorchidism. What information to include? Well, what is a cryptorchidism? Well, orc has to do with your testicles. Cryptorchidism is testicles. Well, this is both bilateral, are born up inside the peritoneal cavity. They haven't descended. A lot of times with cryptorchidism, sometimes you also see a hernia, which prevents it from coming down. It sort of blocks it. So that's what you would see. Remember, you need to examine these in a warm room, and it'll be followed closely because if we don't get them down, it could cause infertility because it doesn't like the heat inside the body. A multi. When caring for a child with nephrotic syndrome is to alert which classic signs of these orders. What do you see with nephrotic syndrome? Remember, nephrotic syndrome has nothing to do with kidney failure. What you see is the kidneys don't like protein, so it excretes it. Protein comes from within the blood, so it's hypoalbuminemia. Of course, trying to make an isotonic place so it goes right into the tissue. So you see generalized edema, fatigue, proteinuria. You're going to have, not eating well because even your mouth is swollen up with that. And we give steroids with this. Remember, they're also immunosuppressed, so they're leukopenic. A multi. Genital urinary surgery is especially stressful for preschool children. What factors lend to this stress? Preschooler, ages 3 to 5. So they don't fear death. That's not what it is. They fear castration. It's part of their belief. They also believe that something happened to them, that they're being punished. They hit their sister yesterday or bit her, the kid in daycare. Those things, they feel like they're being punished. And they are. They're getting sexually curious. They're touching themselves. They're masturbating. They're also seeing that there's differences, boys and girls. Like, why don't you have what I have? Why do you sit to pee? Why am I standing? All of those questions. Another multi. What special considerations are related to long-term prednisone therapy in preschoolers? What does prednisone do to you, right? I think the one thing that's not been mentioned here, it does cause elevated blood sugars. But the big thing is an increased risk for infection. And remember, they're immunosuppressed on prednisone. They cannot get live vaccines. So that's going to cause a problem, okay? The alteration in nutrition, they're going to be hungry. That's what steroids do. So there's really not an alteration there. And this does not affect the sex organs and giving them any enlargement. To prevent urinary tract infections, which is the best beverage for the nurse to recommend to keep the urine acidic. Because remember, infections like alkaline. So we want to keep urine acid. Now you wanted to say cranberry, didn't you? Well, cranberry juice isn't there. Apple is the other one. I'm actually really lucky. Christian, my grandson, could drink a gallon of apple juice a day if you let him. So I guess he has acidic urine, has never had a urinary tract infection. When weighing the diaper and subtracting the weight of the dry diaper, the nurse records 30 grams and documents how many mLs. So 30 grams equals how many mLs of urine? So you weigh a diaper, of size 1 diaper, it weighed 30 grams. When you weighed it after urinating, it was dirty, it was 60 grams. So you have 30 grams left. It is grams per ml. So 1 gram is 1 ml. So it's 30 mLs, okay? And it works really easily. I was like, gee, that's easy. I don't have to think. A multi. Strategies to prevent reoccurrence of urinary tract infections in a child. So white front to back, increase fluids, make sure they're urinating, cotton underwear, and no bubble baths. I mean, if they want that one, maybe if they'll pee after they get out, right? But I wouldn't do that if they've had frequent urinary tract infections. Protect those kidneys. When do you correct the hypospadius of a newborn? Remember, that's the dorsal opening of the urethra on a male, on the penis. It's down here. It's not on the tip. And I think the key is before they're being potty trained. So before 18 months. Yes, very good. What is the initial sign of nephrosis that the nurse might note in a child? Nephrosis. Remember, kidneys, you think about fluid balances, right? You urinate. That's what it does. So kidneys regulate urine. If there is a osis or inflammation, it could cause peritoneal edema, periorbital edema. So there's a holding of fluids. Remember, kidneys, fluid. It urinates or it holds it. Foreskin is retracted and very tight on the shaft of the penis and unable to return it over the head of the penis. What do? So you go in, you do the morning bath, you pull down and you clean it and you can't get the foreskin up. What are you going to do? You're going to tell the charge nurse right away who's going to call the doctor because it is pinching the foreskin and decreasing blood flow. So it needs to be treated quickly. Warm compresses are going to make it swell more. It's not going to work and you don't have hours to wait, okay? Which urinary diversion procedure is the least damaging to the body image of the adolescent? So remember, this is where you have a urostomy. That means you have urine because your kidneys, your bladder's not working the way it should due to whatever. Usually it's structural. And the name of this is called an ilia conduit. That means they have taken the ureters and putting them into the bowel. So it is leaking urine into the intestines and it comes out the rectum because there's no urethra. It doesn't come out that way, okay? It's better than having a bag on, which is what we're trying to do because of body image. What foods does a nurse recommend the child with acute glomerulonephritis to avoid and prevent hyperkalemia? So which of these have a lot of potassium in it? So bananas are extremely high. When you're talked about people who are on water, diuretics, they would say have a banana or orange juice. Those are high in potassium. So if you have a child with glomerulonephritis, which means their kidneys aren't working well, means they're holding on to fluids, they have elevated blood pressures, you don't want their potassium to go even higher because remember, this is the kidneys. So you would not give that child bananas or orange juice. Which physical assessment will the nurse omit when caring for a 2-year-old child diagnosed with Wilms tumor? So remember, Wilms tumor is an adrenal tumor and it's very fragile. And little pieces can break off and go into the peritoneal cavity, causing a metastasis. So no palpating that abdomen. You have to be very gentle and careful there. What is the probable cause of acute glomerulonephritis? Remember, it's the same cause as rheumatic fever. That's why we have to teach our parents and child, if they have a strep throat, that they need to take every little drink of that antibiotic. They have to finish their prescription to prevent these sort of things. Another multi. What will the nurse caring for a newborn with exstrophy of the bladder include in the care plan? So the bladder is bored on the outside of the abdomen. We have to keep them on their back. We have to protect that skin, and that bladder needs to be covered with a shield. We need to keep that integrity there. Diaper tightly? Oh no, we don't want to restrict anything there. Good job. A child has a burn evidenced by pink skin and blistering and is in pain and crying. What type of burn is this? You know, there's different degrees, first, second, third degree burns. You have one of your case studies right now doing burns. So when we see pink skin blistering, that second degree superficial, and remember, still pain. When the pain goes away, now you're to third degree. Good. A child's brought to the emergency department with burns on the face and chest. What is the nurse's first priority? So his face and his chest are full of burns. What are you worried about here? And when you're looking at any child and you're looking at treatment, it's always ABCs. You want to see, is there any burns inside that mouth? Because it could be very silent, and these children could have swelling in the trachea. They could have respiratory distress. Very good. What should the nurse stress to the mother of a child with impetigo? You know, my grandson came over to my house, and my daughter said, look, he's been scratching his insect bites, and look, they're getting miserable, and now they're juicy and oozy. And I looked at it, and I went, that's not a scratch, that's impetigo. Impetigo is from a scratch, and staph gets inside. It's extremely contagious. It requires oral antibiotics, and it requires topical antibiotics. I had to keep the kid for a week here because he couldn't go to school. It was the back of his knee, and it was so painful he couldn't even bend his knee. He had to hobble around on it. So it was quite an infection. And usually when it's all healed up, you might see some pink discoloration, you know, for years afterwards. It's very deep, that infection. Documenting the description of a skin assessment, what term can be used for an elevated fluid-filled blister? So now we're into dermatology. This is what you need to know to be able to describe any sort of rash. Well, this is called a vesicle. Very good. Another multi. Which factors activate the herpes simplex virus type 1? You know, I call that the cold sore on the lip, right? Anything. So fevers can cause it. Being out in the sun can cause that herpes to come out. Stress, that affects everything. That affects hormones, which is also the menses. So it is all of them. Only see prescribed amount of ointment to the skin of a 2-month-old infant. How is the infant skin different than adults? And this is your discussion question for this week. So you only use prescribed amounts. You're given this big old tube, but if they say only 1-inch ribbon, that's all you use for whatever they're telling you. Infant skin, they absorb very quickly. For instance, if you're using a steroid cream, that can be absorbed into the body. So now you're getting high levels of steroids, and that can cause other sorts of problems for that infant. Football players are taking oral grisulfolin for tinea pedis. What should the school nurse caution them to avoid? Now, this is a fungal infection. You know, athlete's foot is a fungus infection. And if you drink alcohol while on this oral medication, it causes violently vomiting. Okay. It's almost like you give this medication to an alcoholic so they don't drink, called antabuse. And if for some reason they feel like they need to take a drink, that one little drink will cause them to have profuse vomiting and vomiting and vomiting. So even though, you know, this is probably adolescents, well, we know adolescents, make sure they know not to drink anything for any reason because they will be very ill. What must be started before a 17-year-old girl starts the Accutane for her acne? It's a black box denotation of this. You know, Accutane is really the last resort for really bad acne for teenagers. And they try everything else first before they go to this one. And they have to sign a contract that says that they will not get pregnant during this and that they will be taking the oral contraceptives because it causes really bad birth defects, okay? This is a big thing for your adolescent. No sex, they have to be on oral contraceptives because of those, you know, birth defects, and they're quite severe defects. What allergy would contraindicate the use of silvadine for burns? I mean, this, you know, use of this cream, silvadine, is great. It takes the pain away and it helps with healing. Also, another medication you have to be careful with a silver allergy is also furosemide, Lasix. So you'd have to use a different one. But sulfa, you can't take Bactrim, Septra, you can't take that, and also the furosemide. What is the correct nursing response to a mother who asks, how can I get rid of the baby's cradle cap? So the baby's born with all of that like flaking white stuff in their hair. You know, and you want your little girls to be cute and put little ribbons and stuff, and they got all this flaking cradle cap up there. So it's as easy as put some oil on at night so it's nice and moist, and then it stays there. And then in the morning, then you wash it off. And then you take a very fine, soft little comb, you know, a brush, and just brush it out. Nothing hard, nothing rigid, but in time, it will all come off. A child's experience intense itching in the axilla and between the fingers, and it's worse at night. What is this? What do you suspect? And this is scabies. Eczema, psoriasis, it's not worse at night. It's always bad, you know, and it's not head lice. It is not, you know, anything. It's just scabies. And remember, scabies, they're going to have to put on medication from head to toe and usually repeat it. Then you're going to have to wash all of the bed linen. Usually it's picked up on vacation a lot of the times in the mattresses in some of the hotels, scabies, and it is contagious. Nurses when they hear a child or their client has scabies, they'll put on those yellow gowns so that they don't get it on them. They're just so afraid of it. So an adolescent presents with a butterfly rash. What diagnosis does a nurse suspect? This is on the face. You know, and that rash could look like many different things. And that is lupus. So remember, lupus is the body fights and attacks its own organs. Rheumatoid arthritis, the body attacks its own joints. So this, one of the things is the butterfly rash that alerts the medical community. We need to start looking at it. Is this lupus? Because that's usually one of the telltale signs. A multi. The nurse speaking to junior high school students informs them that acne can be exacerbated by which drugs? When you get into junior high, these kids are starting to be worried about their appearances, and, acne is a big thing. So there are some things that can make it worse or exasperated. They usually put them on oral contraceptives to get rid of it, believe it or not, the hormones. But phenobarbital and phenytoin used for seizures, both of them. Remember, phenytoin, Dilantin also has got those big, thick gingivitis type stuff, but really bad acne. You can see 6-year-olds come in and you know that they're on phenytoin because they have acne. And you're like, yep, and the kid's a seizure kid. And steroids, another thing that can cause acne. Another multi. Which food sources are high in soluble fiber? Remember, we want to give fiber to those children who are diabetic, right? It helps with sugar. Helps with fat too. So soluble fiber, that's the difference here. Raw fruits, beans, and raw vegetables. Bran cereal is not soluble. The other ones are. That's the difference in the wording of this question. A multi. Which symptom does the nurse recognize as a sign or overdose of levothyroxine, Synthroid? This is a hormone used for the thyroid. So overdose is too much thyroid hormone. What do you see if you have too much thyroid hormone? Elevated heart rate, blood pressure, irritable, diaphoretic, tachy, chest pain, difficulty breathing. It's just, I feel horrible. It's also called a storm, a thyroid storm. You'd be a weight loss. Sometimes diaphoresis, but mostly that irritability, tachy, and chest pain and difficulty breathing. Glycosated hemoglobin test. It can evaluate average glucose levels over a period of blank to blank months. Remember, this is something that either measures if you have diabetes, it can show you blood sugars for an extended period of time, or it can show you if you're being good with taking insulin and watching your diet. And it's 3 to 4 months. It tests it. It's the glycosated hemoglobin A1C. What occurs as a result of an inadequate secretion of insulin? If you don't have insulin, what happens? So increased fat breakdown leads to ketonuria. So We know if you don't have sugar, if you have sugar and no insulin to break it down, the body's hungry. So it goes to fat and proteins. And the byproduct is ketones. So you'll see it in the urine, ketonuria. A child receives some regular NPH insulin at 8 o'clock, and at 8:45, the breakfast trays have not arrived. What do you know you need to do? What did I tell you about giving regular insulin to a patient? I mean, you're covering before breakfast. Well, you've given something that works really, really quick. So you've given regular insulin. The NPH I'm not worried about. The regular insulin, they need something now. So give them a snack, give them something. And graham crackers, milk, that'll work until breakfast comes. Or else the child is going to go hypoglycemic. A child with diabetes is brought to the ER. He's flushed, drowsy, and his skin is dry. The child's experiencing what? So that's ketoacidosis, all right? So flush, drowsy, skin is dry, they're diabetic, the one thing I'm going to check is the blood sugar and get a urine on them right away, see what's going on. A 4-month-old infant is lethargic, sleeps 18 hours a day, and they snore. This is signs of what? Remember I told you about noisy respirations. And that is hypothyroidism. Symptoms of adult or child thyroid, hypothyroidism are very, very similar. The only difference between the two is, remember, when it talks about children, you worry about their cognition and you worry about their growth. So if they don't have enough hormone, they have no energy, they're just going to sleep. And then they get to the point of snoring. A child type 1 diabetes has hyperglycemia, diaphoretic, and headaches in the morning. What is this called? That one is called Somogy phenomenon. So they go hypoglycemia during the night, but by the time they wake up, their blood sugars are elevated. After a closed head injury, the child begins to excrete copious amounts of urine with a drop in the blood pressure. What does the nurse suspect? Remember, when you talk about head injuries, there's things inside the head and it swells in there. It's pressing on all different things. Remember, you have the pituitary gland in there. And sometimes this is one of the signs that's showing you. Remember, the pituitary gland does affect urine output, whether holding the urine or too much. So you are going to start to see this child very thirsty also with that. What does the nurse instruct a 12-year-old to do when teaching how to administer insulin? So you're going to inject the needle straight down. I mean, that's what you're going to teach them. Usually 12-year-old has enough subcutaneous tissue to do it that way. What does the nurse instruct a 11-year-old diabetic child to use? Why do they tell them to use the side of the finger for blood testing? So instead of pushing it on the end, why do we tell you on the side? Why? It has to do with pushing the phone, using your phones? Or is there something else? It has fewer nerve endings and actually has more capillaries on the side, so it hurts less. And you can still use your fingers for your cell phone, right? What is the function of an insulin pump? So an insulin pump delivers a slow, continuous infusion of insulin. These children are taught even how to give boluses and checking their blood sugar. They're great because they can stick one little needle and leave it there all day long. And they don't have to keep sticking themselves with repeated doses of insulin. Another multi. What does the nurse remind the adolescents with diabetes that soluble fiber in the diet can reduce? Soluble fiber again. Remember that means not brand cereal, right? So it's insulin requirements, serum cholesterol, blood sugar, 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 sugar. And if you're regulating sugar, you don't need as much insulin. And it does help with fat, which is serum cholesterol. It's a good thing to eat for all of us. Another multi. What signs and symptoms will alert parents of the possibility of ketoacidosis? So ketoacidosis is when the body doesn't use sugar, the sugar level goes high, it starts eating fat and protein, ketones are made, your breath smells like a rotten peach. It is really an amazing smell. It smells exactly what I described, was that smell of a old rotten peach. It's sweet, but it's almost sickening. And with that, you're going to be nauseous. A multi. Why are children more prone to insulin reactions? You know, they have hypo and hyperglycemic episodes all the time. Why? More than adults. Why? Because their condition is more unstable. They're growing. With children, they don't eat the way they should, etc. So all of these things can cause problems with insulin and their body. How do they tolerate? And you can change insulins also. Proper hand hygiene process should take a minimum of how many seconds? Isn't it you sing happy birthday? And the answer is 15 seconds. That's what it should be, according to your book. A rash has an erythematous circular raised lesions and is called what? Erythematous circular raised lesions. I mean, erythemus or erythema is redness, okay? It's a great word. But it's called papular, okay? Knowing the names of these things, you've had 2 of them in this thing, you need to know those. What type of precautions are necessary with varicella? Varicella is chicken pox. It's in the air. Did you know that? Chickenpox is in the air. It's not the contact, it's airborne. These kids need to be in reverse airflows if they're being admitted. What is most likely way the child contracted hepatitis A? Now, there's all types of hepatitis, but hepatitis A, how do we contract that? I mean, we think it has to do with blood and body secretions. That is your BC. This is a shrimp. This has to do with shrimp carrying the hepatitis. Which vaccine would be contraindicated for an 18-month-old child allergic to eggs? We know live vaccines are contraindicated for those that are immunosuppressed or on steroids. Egg allergies is influenza. Very good. A child's rash was present on the trunk, extremities, face, and cheek were bright red. This type of rash is called what? The cheeks, they call them slapped cheeks. And we call that fifth disease. Okay, it's a viral infection, it is contagious, it's those big red cheeks and fever, and that slap face, fifth disease. A multi. What are the most likely reasons a female adolescent with STDs resist reporting the condition? So maybe, they have some sort of, sores and whatnot in their private area, and they know they need to get treatment, but they are afraid to report it. And why is that? Well, she don't want to tell them who it was. She don't want her parents to find out she's having sex, probably, but she don't want to get that pelvic examination. She's afraid of it. And she's really, really embarrassed. It's all of those things. A child is in the prodromal stage of varicella. What does this mean? So varicella, chickenpox, prodromal. What does that mean? I mean, remember in varicella, there's points where you're exposed, then you break out with a rash, and then the rash crusts over. All of those are different stages. But prodromal means they're exposed. They already have the disease, but you don't see anything yet. The rash is not there yet. They say varicella, they can go with other people once all the rash is dried and crusted over. When should the hepatitis B vaccine be given to infants born to a hepatitis B positive mother? Well, we know hepatitis B is given before they leave the hospital when they're born. We know that. But what about the mother has hepatitis B? Is there a difference? Within 12 hours, they say, and that can help prevent them from getting it. Which classification of medication would make a child most susceptible to an opportunistic infection? Corticosteroids. Corticosteroids make you super immunosuppressed to everything. Another multi. What will the nurse instruct the family to prepare in a disaster kit in case of emergency? You know, I live in South Florida and I lived through some pretty powerful hurricanes down here. And they're always telling you what to prepare. I mean, your medications for a month you should have on hand, but non-perishable foods, blankets, pet food, not a TV. They say a small radio should be there, but not a TV. Which finding would lead the nurse to delay the administration of the DTaP for an infant. So you're trying to get an immunization. You know, we give that at 2, 4, 6 months. When would you not give it? You delay it. That's why a lot of these children, you know, are delayed on their immunizations. If they have a fever, if they're sick, that's when you're not going to give it. They have to be healthy to get an immunization because you're literally giving a little bit of that disease to the child so the body can build up immunization against it. And last question, of course, a multi. What sources are examples of an acquired immunity? So you're born and you don't have immunity to certain diseases. How can I make my body immune to them, or with least chances of getting it? And that is when you have the vaccine or you get the disease. The IVIG is an immunoglobulin, no, and the gamma globulin, same thing. It's the vaccine or the disease. Okie doke. Let's see how we did. Number 3, Tiff. Good job, Tiff. Good job. Number 2, Charday. Good job, Charday. And number 1, the whole time through, Tamika. Good job, Tamika. Christina and Tiona. Who came in and has iPhone in on their phone? If you look at it, could you tell me?
Me, sure day.
Oh, you're on 2 of them, okay.
I like to screenshot the Kahoot so I can go back to.
That's not a problem. Okay, I'm just making sure because I just see iPhone there. I don't know who it is. Okay, I see somebody's already started it and somebody finished it. If you've already finished the quiz, I can't accept it because you didn't do it with me watching you. Go to your modules and I want you can start your quizzes. Remember, next week is an exam. Please come a little bit early so we can set you up and get you ready for it. If anybody wants to have a little tutor before the exam, please make an appointment with me. I want to help you get through this. Okay, all of you are pretty smart. You all work pretty hard, and I want you to be able to get the grades you are doing good, okay? So go ahead. Good luck, guys. You know the answers to this.
I'm done. Have a good day.
爬上了，爬上了，爬上了。